and welcome to a special edition of Meditalk. Today we are going to have a panel discussion to cover an urgent matter. You can guess it. It is COVID vaccination. All over the world, experts have come to a consensus that vaccination is the only way to get out of the lockdowns, or the only way to normal life during this pandemic. In Australia, a big majority of the population is under strict lockdowns. As you know, Australia has done an exemplary job in controlling the pandemic and avoiding a crisis compared with many other countries. But the question is, how long can we remain in lockdowns? Here is the importance of vaccination. So we are privileged today to have a number of doctors with us. They are experts and specialists in various areas. So let me introduce these doctors. We have Dr. Anup Sinha. He's a doctor specialized in microbiology. Microbiology is a subject studying germs, such as viruses and bacteria, and he's well studied in vaccine. Welcome, Dr. Anup. Then we have Dr. Anish Nair. He's joining us from regional New South Wales. He's a hematologist. Hematologist is specialized in diseases affecting blood diseases, and therefore he's in an authoritative position to talk about blood clots associated with AstraZeneca vaccine. And we will come to those issues shortly. And before that, let me introduce Dr. Manoj Kumar. He's a consultant psychiatrist and a very experienced psychiatrist, specialized in treating psychological conditions in people with medical illnesses. Welcome, Dr. Anish and Dr. Manoj. And we also have Dr. 𝐧𝐞𝐞𝐿, and some of you might know him because he was our guest before. And he's an ICU physician. People with severe COVID end up in ICU as the last resort. And welcome, Dr. 𝐧𝐸.
Thanks. Thanks, Dr. Elias, and hello to our panelists.
And I'm very excited to inform you that we have doctors from different parts of the world. And so in a way, this is a global meet. Dr. 𝐚𝐚𝐿, he's a doctor who managed a COVID ward in the United Kingdom last year, and he is joining us from the UK to share his experience. Welcome, Dr. 𝐚𝐚𝐿.
Hello, and thank you for having me.
And Dr. Hiran Ravindran is a pathologist working in Abu Dhabi, in UAE, and he is also keen to tell us about his experience with an advanced vaccine program. Welcome, Dr. Hiran.
Hi.
And we have, thank you. We have got two more doctors. Dr. Prasannan Ponganam, he is actively involved in various social activities, and he's a rehabilitative physician working in regional Victoria. And Dr. Jinesh also is here, very actively involved, and he needs no introduction. People know him very well. So let us start. So I know this is a very sensitive topic, vaccination. So we will start with some basic questions and start with Dr. Anup. Now, people have many concerns about vaccine. And one of the basic thing is, do vaccines work? Are they effective? Can you tell us about those things, Dr. Anup?
So yes, the question on whether vaccines work and how effective they are. Now, when you talk about the efficacy of a vaccine, you can look at it from several different angles. One, do they prevent the infection as such? Do they prevent the disease from the infection? Because we know that infection doesn't always translate into disease. Three, whether they prevent serious infection, whether they prevent death due to the infection, due to the disease, and so on. Now, any criteria you take, COVID vaccines do work. Now, the The degree of efficiency might vary, but it might prevent maybe 70% of the infection in the vaccinated people. But as you go further down, the more for example, disease might be prevented in more than 80%, and mortality, or rather, disease severe enough to warrant hospital admission or severe disease is prevented in more than 90%. So by that criteria, COVID vaccines do work and they are efficient at what they do.
Thank you, Dr. Anup, and you have beautifully explained that they are effective, but in order to convince people who are very much concerned about this vaccine, they have a lot of questions about vaccine. So it would be good if you can explain how these vaccines work. What do they do to our body?
Types of vaccines, each has a slightly different way of working, but essentially what we are doing is we are trying to mimic a natural phenomenon whereby a foreign organism, a virus or a bacterium, enters our body. That's a normal phenomenon that we see, and then our body produces an immune response, antibodies against it, and thereby the next time the same virus or bacteria enters, your body fights that infection off. Now the vaccine tries to, or rather what the vaccine does is something similar without giving you the disease or the infection as such. One way of doing it would be to use a killed vaccine, that is inactivated vaccine. You can just inactivate the virus or the bacterium and inject it. Examples would be the old pertussis vaccine, which had been used. That was one way of doing it. The other way of doing it would be taking very small quantity or relevant parts of the virus or the bacterium only, thereby giving you what is known as a subunit vaccine. Example would be something like our hepatitis B vaccine, where we only have the hepatitis B surface antigen in the vaccine, because all you need is immunity against hepatitis B surface antigen, and that will give you immunity against the disease. The other way of doing it would be using a live attenuated vaccine, say something like our BCG. The organism is alive, but it is attenuated. Its virulence is reduced, so it won't cause disease, but it will cause your body to become immune to that particular organism. With COVID vaccines, we have two relatively newer techniques. What we do is we use either viral vectors, as in the case of AstraZeneca. So essentially, understand that we just want our body to produce antibodies against.
Sorry, Dr. Anup, sorry to interrupt. Can you just explain what a vector is, just for the public to understand?
I'm coming to that. So all you want to do is you just want your body to produce antibodies against a specific protein produced by the COVID virus, right? Now, what you do is you take the DNA, or rather, in this case, the RNA that encodes for this particular spike protein, put it into a different virus, something like an adenovirus, use it as a carrier. Now, this carrier virus is called a vector, and this is kind of attenuated, inactivated. Not exactly inactivated, attenuated. You inject this, and this virus attempts to replicate, but it cannot undergo a normal replicative cycle like normal adenovirus. It just produces the spike protein after this infection.
Because it is weak.
Because it is weak, and it has the genetic material only to produce a spike protein and very little else. So when your body encounters the spike protein, it will start producing antibodies against it, and then remember how to produce antibodies against it. That's how the AstraZeneca works. Then coming to the Pfizer vaccine, that takes a different route altogether. It's an mRNA vaccine. So a basic biochemistry is that for any protein, you first need a template, and this template is the mRNA, messenger RNA. Now you inject the mRNA, cells in our body are going to take it up. Now our cells also produce our own proteins using mRNA. So this mRNA, as far as our cellular mechanism is concerned, is not very different from any other mRNA. So it gets translated into proteins, but this one is encoding the spike protein. So our own cells produce the spike protein. Mind you, not the entire virus, just the protein, the spike protein. And our own cells start acting against the spike protein, and we get immune to it.
Yeah. So on one side, these viruses and messenger RNA, they are weak and they do not cause infection in their own way, but they generate immunity. So people have concerns, when these things are injected into a body, what happens? I mean, we have got so many questions from the public, and so please stay with us. We will come to those questions soon. Now, Dr. Anish, Dr. Anoop has explained this, and those things make sense, that vaccines work and how they work. Still, many people in the public have concerns about their side effects. And one of the common side effects that we hear is blood clot, especially with AstraZeneca vaccine. Now, you're a hematologist, and so you work in this specialty dealing with blood clots. So what can you tell us about this? How common is it, first of all?
Well, as Alby, you rightly said, one of the major concerns about people who are going for a COVID vaccination, particularly AstraZeneca vaccination, is they are all worried about a development of a possible potential blood clot, which is a well-known entity at the moment, but as such, if you see, the incidence is quite rare. If you see, on an average, the incidence is 2 to 3 per million. If you look at different age group, we find it's more common in people less than 50 years, where the incidence would be roughly around 3.2 per million. But older age group, particularly when go above 70, the incidence is much less. It's roughly about 1.8 per million.
So am I right in saying that this is even rarer than possibility of a road accident?
That's correct.
Right. Now, okay, thank you. That makes sense. But now, why is it a problem with AstraZeneca vaccine? Why not with Pfizer vaccine?
So if you look at the mechanism, it is basically an immune-mediated activation of a platelet component called platelet factor 4, which is being activated, and antibodies formed against platelet factor 4, leading on to platelet activation and thrombus formation. So in that process, platelets being consumed to make thrombus. That's why we developed low platelets. So the different vaccines we got against COVID. We already previous speakers already mentioned about different forms of vaccines. The AstraZeneca vaccine is particularly we know that this is an adeno-vector-based vaccine. Yep. Similar vaccines like Johnson & Johnson is an adeno-vector-based vaccine. Yep. So this is more often seen with vaccines produced with an adeno-vector-based, because I think somehow the adeno-vector component might be forming some form of immune dysregulation. It may be either forming a complex with platelet factor 4, or we don't know the right mechanism, but this is probably the vector-based immune activation leading on to thrombus formation. So this is not seen in a Pfizer vaccine, because it is a pure naked mRNA vaccine where we don't use the adenovirus vector.
Thank you for that clarification. It really helps, Dr. Anish. Now, we have a honored member from the public. Preeti Malcolm is here with us. Welcome, Preeti, to the program. And I understand that you have a question. So we have got eminent specialist here with us. So please go ahead. What would you like to ask?
Thank you for the opportunity. Now, as a parent of a teenager, I am worried and skeptical about this vaccination. Are there any known side effects in young adolescents similar to that of adults after the vaccination? How does it affect their immune system or changing hormones? And also, if a teenager decides not to get vaccinated, what are the long-term issues or implications?
Yeah, very genuine questions. Thank you, Preeti. And I think, can you answer these questions, Dr. Anoop?
Okay, let's start with the last part of the question. What are the long-term implications? Well, if we need a way out of this pandemic, we need to reduce the spread of the virus, what we refer to as the R0, the potential for a person who is infected to infect other people. One way we can do this is by making sure that most people around an infected a person is immune. And vaccination is one of the best ways to achieve it. The other way is more horrific because it comes with a huge death toll. What I mean is, if you get infected, okay, many of the people are going to get immune that way, but that comes with a really horrific death toll. So yeah, that is the long-term consequence. The greater the proportion of people in the community who are not vaccinated, the longer it will take for us to get out of this pandemic. That is one. That is when we consider it at the level of the community, as at the level of the population. Now, coming to the level of the individual, if you would look at the figures that are coming out of the US right now, you would see that a lot of people have been vaccinated, but they're still having cases, they're still having admissions. However, the figures always say that the people getting admitted with COVID, more than 90% of them are not vaccinated. The people who are not getting vaccinated, they are the ones getting admitted. And they are the ones who are disproportionately represented in the death toll there. So vaccination is, even for adolescents, is not for their own protection alone. It is for the protection of the community as well. Works both ways. Now, regarding the other issues, I believe the vaccine that has been approved for adolescents is not the AstraZeneca, it is a Pfizer. Yeah, so the Pfizer vaccine contains an mRNA, the messenger RNA, and that particular, similar compounds or similar chemicals are being produced in our body in every single cell on a daily basis, every second, every day, right? This is just a drop in the ocean, what we are putting in. Exposure to antigens occur in every human being, every day, every second. Again, this extra antigen that is coming in is just a drop in the ocean. It's nothing to even sneeze at. So with an mRNA vaccine, again, the potential for even the rarer side effects, what we are more worried about would be, like Anish said, blood clots. Even that possibility is really, really low. Second, the best thing we can do for our children is improve their odds, right? Now, the odds of getting a blood clot after getting infected with COVID is much, much higher than what you would get even after getting an AstraZeneca vaccine.
Dr. Anoop, do you see any possibility for hormonal changes with the vaccine? Any theoretical possibility?
I'm not aware of any such possibility in that aspect. Now, vaccines are not anything new. We have been using vaccines for several years now, almost how long has it been? More than 100, almost 100 years, or even more maybe, if you consider the original smallpox vaccine. Now, it is only that the delivery mechanism has been modified, has been made more efficient. That is the only change in these new vaccines. So, one more vaccine for a teenager is not really going to have any effect on their hormones or growth or anything of that sort.
So, have these responses been reassuring, Preeti? So, it looks like we lived with vaccines, generations lived with vaccines for decades, and there is no way that we can foresee changes with these hormones or growth of adolescents. So, do you have any more questions?
No, I definitely feel more relieved and convinced. Thank you so much for the opportunity once again. Thank you.
Thank you for attending and thank you for your contribution.
Thank you.
Now, in continuation with those concerns, Dr. Anoop, these people say that, a part of their reluctancy is that this is a new technology, and some say that should we try mRNA vaccine, a technology that was, these people argue, never used in humans. So what can you tell us about that?
Let me put it this way. Now, initially, the triple vaccine, the DTP vaccine, had killed pertussis cells in there. It did cause some amount of side effects, and then we refined it, made it an acellular vaccine, removing the cells and purifying it, modified the vaccine to something newer, which had less side effects. Now, the reason why it had less side effects, the acellular DTP vaccine, is that they removed the bacterial cell out of it using only certain components from it, right? Now, when it comes to the AstraZeneca or the Pfizer vaccine, we are even using less and less of the original virus. Yeah. So the chances that something could go wrong compared to a traditional vaccine is even less. That's the way I understand that.
Thank you. Is it true that we had this mRNA technology in humans more than 10 years ago as part of cancer therapy?
The technology has been around for a while. It is only with the COVID and when it started getting used for vaccines that the general public became aware of it. Otherwise, this has been around for a long time. There has been several trials for this vaccine anyway, and its safety has been proven. I really don't see any reason why just because it is new doesn't mean that it is not safe.
Yeah, we can tell the public and our audience that so mRNA vaccine is not entirely new. It has been trialed for other diseases like cancer. So I think that's good news. Now, Dr. Manoj, we'll go to Manoj and come back to Dr. Anoop later. Dr. Manoj, as Dr. Anoop and Dr. Anish have explained, the vaccines are safe and effective, and some of the side effects are mostly minor, and the rare side effect is extremely rare. But still, people in the community are worried. So how do you see this problem?
Thank you, Dr. Alby. It's a very interesting situation we are going through, isn't it? Since the time we started to have this battle with the coronavirus and COVID situation globally. So we've been also going through something like a psychological pandemic, experiencing a lot of stress, anxiety, fear, and the impact of this on our lives. Most of us, including anybody in the society, we are all in this together. We are all going through this. So the general level of stress, anxiety is much higher in people these days. When it comes to COVID, it's a matter of survival. So survival emotion is anxiety, how we survive in this situation. So the vaccine was seen to be an answer for survival, but then it came with a lot of rumors, a lot of side effects reportedly, and highlighted in the media, the information, which was available to the public about side effects has significantly contributed to the anxiety around and the fear about the vaccine. So if you think about the fear and anxiety situation, your decisions are affected because of these emotions.
Yep.
So when your emotions are heightened, that has an effect on your behavior, on your thinking process. So if you look at that point of view, when your emotions are heightened, especially the negative emotions are heightened, you look at and you get attracted to the negative aspects of the vaccine. So then you'll see more of the side effects, even though it's a rare side effect, you'll see more of that rare side effect. And once you do that, and it's human beings have got a tendency, they can either have a negativity bias or they can have a optimism bias. This is confirmation bias. We call it a cognitive bias in our thinking. It helps the way our mind works, the mental models or the heuristic thinking helps us to take decisions. Especially this is an important decision in our life about to take vaccine or not to take vaccine. So these are mental shortcuts to take decisions. So we're using one of that. The negativity bias is working very strongly here. We very easily, this comes to our mind to take a decision about the vaccine, that there are side effects, and we take a decision not to have the vaccine. And this is complemented with the situation with the optimistic bias, where people will underestimate the risk of that particular person having the illness or the risk, the high risk situation is not going to happen to them. They underestimate their risk. So they may not have the vaccine because they think they would not have this condition or this problem at all. So that also make them not have the vaccine.
It's a kind of denial, isn't it?
A kind of denial. And most importantly, the other aspect is the trust on the vaccine and the trust on the authorities. There is a mistrust, and that leads to a lot of people not having the vaccine. A couple of other factors could be contributing psychological point of view. Things which are convenient, the availability and going and getting the vaccine. If it's more convenient, they are more likely to have it. If it's not that convenient, they use that as an excuse in not having the vaccine. When it comes to information, again, your reading is influenced by, your bias already, that you're biased with the negative aspects of the vaccine. So you're only reading to confirm your negative bias, not really getting the information to change that bias. And it ultimately also comes down to, particular person's personality, whether, I take the vaccine for myself or I also take the vaccine for the community. If I take the vaccine, the virus will not spread. And that way I can contribute to the society. So there are several, psychological factors playing in this situation with vaccine hesitancy.
Yeah, you have explained so many factors, quite interesting, Dr. Manoj, very brilliant explanation. And so the last thing you mentioned, it's also an altruistic decision, to save the community by receiving vaccine. So that is very striking. Please stay with us. We have got a few more questions. So before that, Dr. Satyajit, you are working in ICU. You have been doing this job all along during this pandemic. So you worked in ICU last year and you are still working. I think you work today. So you may be able to tell us the difference you see between last year when there was no vaccine and these days when we are receiving vaccine. So is there any difference between ICU admission between people who are vaccinated and those who were not vaccinated?
I guess besides my personal experience in the western suburbs of Melbourne, where we had a reasonably large epidemic by Australian and New Zealand standards, where we didn't have the vaccine, we had a fairly large number of cases in my hospital, in intensive care. Not certainly to the scale of what Dr. Naushad is familiar with in UK, but by West, we had nearly 1/6 of the ICU patients in the country in our ICU. Whereas this time, obviously, cases are mainly in New South Wales, so I'll have to use their statistics. We do have cases in Melbourne. In New South Wales, to give you an example, say last week there were around 550 cases in hospital early last week, and around 75 in ICU, and there was no single person who was dual vaccinated, who had 2 doses of vaccine at that point in time.
That is a very, very striking figure, isn't it?
It is. And also the rest of the people, there were a smaller number who had 1 dose of vaccine. So people who had both the doses of vaccine, there were not even a single person last week. I believe this week, out of a larger number, there may be 1 person perhaps, but in a huge number of caseload. So there is certainly a difference. And this is repeated everywhere in the world. In Israel, to give you an example, in UK, wherever there is vaccination, the critical illness, which means severe illness, severe hospitalization, ICU admission, and even in the ICU admission, patients who need higher degree of support, more invasive ventilation, being on breathing machine, is dramatically reduced by vaccination.
That is in tune with what Dr. Anoop said in the beginning. Like, what do you look at when we talk about the effect of vaccine? Whether you look at severe illness or ICU admission, so there comes the difference. So our message to the audience is that whether you want to go to ICU, even when you get the infection, so there your words are quite strong. Like, even if you get infection, you don't end up in an ICU with vaccine. So in line with that, I will ask Dr. Naushad about his experience in the UK. So, UK is the country that is experimenting with the Freedom Days. And to my understanding, their vaccination rate is substantially high. So Dr. Naushad will have these things to tell us.
Hello from this part of the world, and thanks for giving me this opportunity. Yes, I think you guys from across this oceans would have seen the horrible scenes from UK hospitals, and almost a year ago, where every day our average mortality was around 1,000 plus deaths a day. I mean, that is when we used to have 30,000-40,000 of cases per day. Our death rate was 1,000 to 1,500 a day, and hospitals were full of COVID patients, almost 20 to 30,000 patients in UK hospitals. Now, since vaccine rollout, something dramatic has happened, that we have opened up completely in July 2019. We call it Freedom Day. Indeed, mask wearing has gone down. Every restriction gone, no social distancing. Everybody is out and about doing everything as we can, as we before, except in hospitals where unfortunately we still have to wear PPE, but everywhere else there is no restrictions whatsoever. You can do whatever you want. And infections are soaring. It is 38,000 infections recorded on average last week. However, what vaccines have done is that these infections, this huge number of infections, have not transpired into corresponding hospital admissions and death. The hospital admissions is way, way below the peak of the pandemic before the vaccination for the same number of infections. So currently we have around 7,000 patients in the hospital, and however, ICU admissions and death is very, very low. And for the corresponding death rate now is around 100 per day for 38,000 patients being diagnosed every day. That was 1,000 to 1,500 a day for that level of infection rate. So what vaccines have done is that vaccines have effectively severed the link between severe illness, hospital admissions, and death from actual number of COVID infections. So that's all we can do. We cannot live forever in bunkers, hiding away from COVID infections. We do need freedom. Manoj has already alluded to about the effect of mental health issues, effect of COVID on mental health issues and how we are going to feel. So the longer it goes on with restrictions and lack of schooling and lack of opportunities, everything, and financial burdens, the longer the toll, the higher the toll on the mental health and physical health and financial health of the people. So I think the UK experience, you can look forward, you can look up to that what happened when a vaccine is effectively rolled out. Now with 88% of above 16 people had one vaccine dose and almost 78% fully doubly vaccinated. This is what you can expect. You can expect life to normality finally without worrying about dying and hospital admission. Yes, you may get infections, but your chance of you dying will come down dramatically.
It's very impressive, Dr. Naush. I mean, we are hearing this news, but it is so, substantial, these figures, and makes a big difference when we hear directly from you, from the UK, from someone who managed these sort of affairs. So I understand that your COVID ward was full last year, with admission. So how many patients do you see in your ward these days?
With this time last year, not last year, this same level of infections before vaccine in November, December, January time, our ward was full. Not just our ward, it was actually half of the hospital was full of COVID. Okay, and all the operations cancelled, everything else cancelled to make way for patients because we had no other way to manage this level of influx of patients. But now it is. It fluctuates, 3 patients sometimes 7 patients, but nobody is dying. That is the important bit. They are not ending up in intensive care. They are not dying. Yes, they come and they get treated. They get treated with dexamethasone, tocilizumab, and so on. They go home. There is nothing more rewarding as a doctor to look after patients, and they go home. It was not the situation before vaccine. We were helpless. We watched people dying in front of us, and they go to ICU, where the ICU physicians tell them that your chance of coming back from a ventilator is 50%, and that will freak out any sane human being. Your chance is like tossing a coin. The chance of coming back from intensive care is 50%. That scenario is gone. The fear from people's mind is gone. It's actual freedom from fear.
Yeah, Doctor, the take-home message is between having vaccine and not having vaccine is like between life and death. So now we have got Dr. Hiran Ravindran from UAE, and Hiran, I heard that the people in the UAE, they are receiving the 3rd dose, and the vaccine coverage is enviously high. So what can you tell us about from there?
Yeah, hello from Abu Dhabi, and thanks for having me. At the moment, when I looked up the net, the percentage of vaccination people, at least 1 dose is 86.53, and
that's amazing.
76% is double vaccinated. And for all those who had done the initial vaccinations more than 6 months back, the government is offering free the 3rd dose. And I've seen many, even myself have taken the 3rd dose.
Wonderful.
And I've seen many of the people are taking the 4th dose as well, especially the medical community. So it is kind of interesting to see that, most of the people are vaccinated, and the daily infections rates are going down, and then the number of deaths is also very low. We total have around 2,000 deaths altogether, and then the daily infections is around roughly in the range of thousands, but deaths is around 1 to 2 in a day. And I'm a pathologist, probably you may not be aware, but one positive thing I want to say for being vaccinated is that I have seen 3-4 pneumonectomies for COVID cases, and the way the lung look is You can't imagine. They look terrible. They look fibrous. There is no way that that can become normal. So seeing that, and if you have a chance of getting vaccinated, I think even though there is a minimal risk of vaccine, all the public fears and all these things are there. This is new. All these perspectives was there in the public, and when you see such a lung, I will take my vaccine dose in the first possible opportunity.
So that is a hidden aspect of COVID, this sort of lung fibrosis, and we don't know how people can live with that sort of lung even when they recover. So this is a very insightful information, Hiran, and thank you so much for that reassuring information. Now we have got one more person joining from the community. Asha is here. She has a question about vaccination. Is Asha here?
Yes.
Hello, Asha.
Hello, Doctor. Hi, everyone. Hope everyone is doing well. Thank you. Thank you for this opportunity. Doctor, my question is in regards to the choice of vaccine. Currently in Australia, we have a choice between AstraZeneca and Pfizer. And there's news of Moderna coming mid-September and rumors of Novavax in December. With so many options out there, and as a person without any medical knowledge into this space, could you kindly give a guidance on which is a better option of vaccine?
Can someone address this question, please? Yes.
Hello?
Anup, yep.
Okay. Now, like I said at the beginning of the talk, if you want to look at which is the most effective vaccine, we have to define what we mean by effectiveness. Now, if you define that as preventing severe illness, preventing hospitalization, preventing death, then almost all the vaccines that are being released are equally effective in all this. They prevent death, they prevent severe disease, and these are the two major things that you want. Now, when it comes to preventing minor infections, mild infections, maybe you could argue that one is better than the other, but it is, well, from that point of view, a bit of an inconvenience rather than anything truly serious. So, my view is that when it comes to choosing a vaccine, get the vaccine you are offered first. The one that is most easily accessible. See, the thing is, in Australia, we haven't had many cases here. Most of us have not been exposed to COVID, and we do not have a high background level of immunity like the rest of the world, which means that as far as COVID is concerned, we are still a virgin population. With slightly more virulent and more easily transmissible Delta variant around, it can rip through this population if we are not vaccinated. So the best thing we can do is get whichever vaccine we can as quickly as possible.
So it looks like our gain is becoming our own problem now. But Asha Menon, thank you very much for your question. But just in continuation with that, Dr. Anish is still with us. Dr. Anish, about this side effect of blood clot with AstraZeneca vaccine, are there any predictors? Like, can you foresee some risk factors for this increased incidence of blood clot? And even if it happens, could there be any warning signs so that we can detect and treat it?
Yeah, in terms of prediction, unfortunately, there is a lot of misconception going among people that people with previous history of thrombosis, previous history of low platelet count, they've always have got this ongoing worry about taking an AstraZeneca vaccine because I've already got a clot, I've got low platelets. What will happen if I take a vaccine? But basically, all of these known risk factors associated, particularly hereditary risk factors associated with thrombus formation and patients with the previous low platelet count, none of these factors is actually associated with an increased risk of clot formation secondary to vaccination. So AstraZeneca related thrombosis is in a unique entity that has no relation with the previous history of thrombosis or previous history of low platelet count. So that is something we need to keep in mind. And with regards to risk factors, unfortunately, we don't have much predictors at this point. We know that people younger than 50 years are more likely to get these complications. So that's, we could probably take it as a risk compared to older people. And newer studies have probably showing that some evidence that probably race has something to do with, because people coming from Northern European descent are actually more likely to get compared to Southeast Asian descent, for example. So there is slight variation. You can see the increased incidence of these complications happening in those people. Apart from that, there is no real predictors, unfortunately. What was your next?
Are there any warning signs so that we can pick it up early?
Yeah, so the key thing to actually reduce the complication is catch them early. So we know that this complication happens between, it more often happens in these first 2 weeks, but it can happen starting from day 4 and can extend up to day 42, but it's more common in the first 2 weeks. But you know that people may get some form of myalgia and headache in the first 2 to 3 days of vaccination. That's common. But if people develop ongoing headache, particularly severe headache, and features of increased intracranial tension, we call it symptoms like blurred vision, epilepsy, motor weakness, or there are other symptoms where increasing abdominal pain, vomiting, or leg swelling, or increasing shortness of breath. Those are sort of some of the cardinal symptoms people you can look for. And if you develop any of the symptoms, particularly 4 days after the vaccination, you probably better get a medical attention, go to a medical person to get further advice and tested.
So the timing is very important. And so just because this vaccine causes blood clot, there is no need to run away from that, because we can still manage this high risk. Now, Dr. Prasannan Ponganam is still with us. I hope he's there, and he's a rehabilitative physician. Dr. Prasannan, do you see patients in rehabilitation? Now, Dr. Hiran was saying about lung conditions which can cause fibrosis. So, there are lots of discussions about the long-term impact of COVID. We never know what's going to happen or what is around the corner for tomorrow. So how about the impact of COVID from a rehabilitative perspective?
Okay, thanks for asking that question. First of all, fortunately, I had no COVID, post-COVID cases in my care. It is because of the low incidence of COVID, especially in the regional Australia. But having said that, what are the long-term complications we can anticipate in a COVID patient, especially the patients having severe COVID? One of the things is that they may be in ICU or in ventilators for a long time. And when they are coming out of ICU and ventilators, they are usually experienced not only the COVID cases, any patient who are having the risk of in the ICU or in the ventilators for the long time, they can develop a sort of ICU related peripheral neuropathy. That is, means the weakness of the limbs and the high deconditioning, which means they will be easily fatigued to do the day-to-day activities. So these are the common things which we are seeing post-COVID. And there is a COVID long, but I'm not talking about that thing. What I'm talking about is the immediate after effects of the COVID, especially when they're having a severe COVID infection. But I have no experience in my care or my hospital, a patient with that severe illness. That is what I think I have to add, that because Australia has not seen the horrific pictures of the COVID, like what Naushad or UK doctors have seen. That is one of the reason, maybe the vaccine hesitancy also in Australia, because people are thinking that we have no such bad situation or severe situation in Australia, which is preventing them and getting a pseudo confidence that we will not get that illness. So that is one thing. It is fortunate that we have no such COVID cases. I don't know, in Metro Rehab, they were telling that, my colleagues were telling that they have a lot of COVID patients in the rehab, especially because of their deconditioning of the cardiopulmonary status, especially when they are getting the ARDS, that is the particular respiratory syndrome affecting the both lungs, and which will affect their ability to breathe properly, especially when they are exercise or do any strenuous job. And these are the two things. One is cardiopulmonary problems, and other thing is the peripheral muscles problem. That are the two things. And easy fatiguability. Many people are saying that they will get very easily fatigued when they do things, and when they compare to, especially some people when they are very fit, that is the rare cohort of the patient getting the COVID. But there are people having the pre-morbid condition. You know that the obesity is one of the risk factors of getting the severe COVID. And their, exercise tolerance or ability to do physical activities may have deteriorated before the COVID. And after the COVID, it will be much amplified they find when they do things which they were doing the same thing before the COVID. So lot of the people, they are getting the COVID in a severe form, having a pre-morbid medical conditions like blood pressure or kidney disease or diabetes. So what I am trying to say is that there will be already a deconditioning or exercise tolerance may have been reduced in their case. And when they get the COVID, it will be much worse. So these are the people on rehab point of view we can see. But on personal experience or personal note, I have not seen such severe COVID patients so far.
Thank you, Dr. Prasannan, for sharing your views. So, but I think you are taking me to the best person to talk about these issues from ICU again.
One thing, Alby, can I ask a question to Naushad? Is he still there?
Yes. Yes,
now your vaccination rate, the double vaccination rate, if I'm incorrect, please correct me. It is around 60-65%.
No, it's more than that now. It has reached 76% for double vaccination above the 16 age group, above 18 age group. Currently, we are focused. Yeah.
As a country, there is a very severe situation with the COVID. What preventing the people getting the vaccination in UK? Is there any vaccination hesitancy in UK? Because why I'm asking is, UK is one of the countries the COVID has affected very badly.
Okay, so another percentage I quoted is, as I said, above 16. There is still a little bit of hesitancy for vaccination, and that is unfortunately more common in people of non-white races, and there is also positively correlated with the deprivation and social factors, and there are so many other mainly to do with deprivation, and there has been a lot of videos and circulating in WhatsApp groups and Facebook and so on, which has caused this problem. And there will be also people who are genuinely scared of having vaccination because of their own underlying already severe comorbid conditions and so on. So I don't think we will ever reach 100% on these things, because some people will be
that's right,
very, very scared, which we have to accommodate for. But the priority is to get as many people vaccinated as possible.
Sorry to interrupt, but I think we are running out of time, but we have so many interesting issues to discuss in the next edition. So that's coming up. But again, thank you everyone for joining us and your wonderful contributions to this an urgent issue, and this is very important to our community. Thank you very much. But stay with us and join us soon in the next edition of Meditalk. See you again.